Hello, everyone, and welcome to the 2020 Rural Health Clinic Workshop presented by the Oregon Office of Rural Health. My name is Rhonda-Ann Gerst, and I am the Rural Health Clinic Program Manager and will be the moderator of this session today. First, I would like to thank our partners, Gold Partners, All Care Health, and Oregon Rural Health Association. Silver Partners, Eastern Oregon Coordinated Care Organization, Oregon Association of Hospitals and Health Systems, and River House on the Deschutes. Bronze partner, RQI, and our copper partners, Westcom, American College of Education, and Inquisique. Their continued support during these difficult times has made it possible for the Office of Rural Health to offer the conference and workshop at no cost to you. You should have received an email with the link to our conference app. Use this app to visit our partners' virtual booths and enter to win prizes, network with others, and share photos of your clinic, providers, or community. We would love to see them. Next slide, please. Session evaluation. After this session, you will receive a survey. Please help us continue to make improvements by completing the survey. In addition, this is how you will receive your CE credits, and you will be entered in a drawing to win a $100 gift card. Next slide, please. To present RHC Policies and Procedures, please welcome Patty Harper, CEO of Inquisique Consulting.
Thank you, Rhonda-Ann. It's my pleasure to be with you today. I wish we were in beautiful Bend for this conference like we have been the last couple of years. And I wanted to let you know that our hearts have gone out to you with thoughts and prayers for the fires that you guys have experienced recently. But we're here together virtually, and we're going to discuss RHC policies and procedures. And so these are our learning objectives for today. We're going to look at what regulations govern rural health clinic written policies and policy development. We're going to talk a little bit about the differences between policies, processes, and procedures. And then we're going to try to bring it home very practically on tips that will help you maintain RHC compliance through your policies. So let's get started. So our first objective is to understand what RHC regulations are out there to guide us. And there are quite a few of them. As we know, healthcare is a regulated industry. Therefore, the framework for our compliance, the toolbox we need for policies already exists. We don't need to reinvent the wheel. We just need to know where to go to find that information. And so if you're looking for a federal regulation, the best place to go is the Electronic Code of Federal Regulations, the ECFR. So if you Google a regulation, sometimes it's going to bring up an older copy. The regular CFR is only updated once a year, but this site with the electronic code is real time. So the link is on the bottom of this slide. So if you're looking up a regulation, this is the website that you want to go for the most up-to-date information. And so the Code of Federal Regulations, so this is our main go-to place for RHCs. 42 CFR 491 is our conditions for rural health clinic certification. And so this is where the bulk of our regulations are. This is what surveyors are going to be looking for. And this is where we find out what's required for policies in the rural health clinic. We have regular Medicare regulations that deal with program integrity for the Medicare and Medicaid programs. These are the regulations that you would go for broader Medicare, Medicaid compliance, not just RHC regs. And then if you're a provider-based rural health clinic, these are our hospital regulations for PPS hospitals. And on the next slide, we have the regulations for critical access hospitals. So those are all of your citations for regulations. If you have special services in your hospital, you may want to go to a few of these other places. I've just listed them, but they don't particularly apply to rural health clinics. So as you can see, we already have a regulatory blueprint for rural health clinic compliance. And so I don't know if you've built a house recently, or maybe you constructed some kind of an outbuilding, a barn or a shed, and you really don't do that without a blueprint. And then when you hire a contractor, he's not going to know what you want to build without having a set of plans. So the slides we just looked at that are our federal regulations, that's our blueprint for RHC compliance, including our policy development. So again, we don't have to reinvent the wheel. Everything is there in the regulations. And so that includes our condition for participation, that includes our RHC certification conditions. So it's all there. So I'm going to give you a little help on what those regulations say about policies. And I'm going to give you some other links to go to for further RHC compliance. So this is that slide. These should be your 4 go-to places for rural health clinic regulatory compliance at the federal level. And so these are things you should have bookmarked on your desktop and have them handy. 99% of your questions about rural health clinics are going to be answered using these 4 resources. Another go-to place are our online manuals. And so CMS has online policy benefit manuals and claims processing manuals for every type of facility. So our policy benefit chapter for rural health clinics is chapter 13, and our chapter for claims processing for rural health clinics is chapter 9. So here again is a link for you. Again, all of this can be at your fingertips, and it takes the mystery out of developing rural health clinic policies and understanding overall rural health clinic compliance. So what exactly do those regs say about policy development? And so they say several things. I have abstracted a few of the big ones for you. And so again, we're in 42 CFR 491, which is the rural health clinic conditions for certification. This is what you must pass for initial survey and all of your subsequent surveys. And so starting at the very beginning in 491.7, our organizational structure. So it's a requirement for us that we have policies, organizational policies, that explain the lines of authority and the responsibilities. So this is going to include our org chart. This is going to include a disclosure of our ownership. This is going to include making sure that we have a medical director identified, and we have a compliance officer identified. So right from the regulations, we're learning we have to have policies about our organizational structure. So this is something that takes the guesswork out of it. We know that's a requirement for our RHC policies. And as we move along and we go into 491.8, the regulation starts to discuss staffing responsibilities. And you'll notice I just have part of the section here. The medical director, in conjunction with the physician assistant or the nurse practitioner providers, participates in the development, executing, and periodic review of the clinic's written policies and the clinic's services. So where this may come into play is if you're in a bigger organization, maybe somebody at the corporate level or somebody at the hospital level wants to completely control your policy development. And here we learn that it's a requirement for RHCs, for the medical director and the other providers in the rural health clinic to actually participate in developing. We also know that all of our providers and our medical director have to review our policies. That review is biennial now, but we always suggest that anytime there's a change in a policy, an addition in a policy, that we get buy-in from our RHC medical staff. So again, here's something else that the regulation tells us about policies. Also, and I've highlighted this slide so that we can really focus on it, how we provide services in our RHC has to be included in our written RHC policies. And so our policies have to talk about which services we directly perform. So we know in a rural health clinic that we're responsible for the majority of our services to be primary care. So are we doing evaluation and management? Are we doing assessments? Are we doing diagnostic testing? Or what about our 6 required lab tests? So these are things we would cover in our written policies. And what about our medical management guidelines? What are the go-to resources for your providers to use? Is it something like a medical management manual? Is it Upholding Graham's Family Medicine? Is Hippocrates used to be the one that we used online, and now everybody uses, gosh, I'm going blank on the name of the new one. So what do we use for medical management? Our rural health clinic is supposed to have one set of medical management policies that are under the direction of our medical director. So we may need to put some of that in writing. Do we have anything that's unique about the way we provide care? Also, when we develop these policies, we need to get the advice of an outside professional. That's part of our program evaluation, is that to include an outside person in our policy development. That can be your rural health clinic consultant. That can be another healthcare professional in your community. That can be somebody else within your organization that's not directly tied to the rural health clinic. So here, in this section, we really need to focus on it, because this is what it's telling us needs to be in our policies. And your accreditors or your state surveyors are going to look for these policies. We also need to have written guidelines for storage, handling, and administration of drugs and supplies in our clinic. This still continues to be the #1 survey deficiency nationwide. So do we have those rules for drug storage, and do we have a process in place for checking expirations? Very, very important. And so 491.9, again, back to our regulation, lays it out for us really clearly. And then we have in the regulation in 491.10, what it tells us we need to have in our written policies and procedures as far as our medical records, what the content of the medical record needs to be, what our process for release of information needs to be in our clinic. So again, medical records are part of the area of our clinic that we definitely need written policies and procedures for. Also, program evaluation. Last year, it was changed to every other year that we have to do a program evaluation in most states. But we need to know how that process is going to unfold. What is that going to look like in our clinic? This is something that our policies need to reflect, and our policies are part of that evaluation process. What policies did we add? What policies did we take away? Which policies did we revise during that period? So again, program evaluation and policies go hand in hand. And the last thing in the regulation that we have specific guidance on is 491.12, and that is our emergency preparedness processes and plans. And so we would go to Appendix Z for more detail about this, but we definitely want to include our emergency preparedness as a written policy or procedure. So there we have our blueprint. We have our compliance blueprint. What also might be included in the required policies and procedures are specific policies that your accreditor will require. So there are a lot of things in the conditions of certification that maybe don't call out a specific policy, but maybe your accreditor, the compliance team or quad ASF wants to make sure that you have covered all of the conditions of certification in policies. So there may be additional policies that your accreditor requires based on their own standards. And this is a screenshot of some of the policies that the compliance team requires. So if you're using an accreditor, you need to check with them and make sure that you're within their standards as well as within the CFR. I like to focus on this, that there is a difference between policies, processes, and procedures. So yesterday I happened to be in a clinic and I was reviewing their policies and procedures, and they had very, very detailed processes, very long policies. And there's a couple of reasons why we kind of want to stay away from putting too much in a policy. More is not always more. And so I like to break it down this way. Policies are very broad statements of compliance. They're going to be static unless there's a regulatory change. So as you remember last year, we had a change in our emergency kit requirements. We had a change in emergency preparedness and in the program evaluation going from annual to biennial. So those are policies. They're very broad and static. Processes are more dynamic in nature, and they're created more internally and in conjunction with other sub-regulatory guidance that we might have. So if we break something into a process, we provide clarity. This can be addendums to policies. This can be other internal documents which outline our processes. And then we can break it down even further into procedures. So these are going to be more like the steps in performing a task. They're very dynamic. They promote efficiency in workflow, and they focus on quality performance. They standardize our task. So we may not want pages and pages of processes and procedures in the body of our main policy, because then when one part of that changes, the whole policy needs to be updated. We also want to make sure that our policies, if we're using part of our parent hospital's policies, don't include processes and procedures that are just unique to the hospital. So I've seen infection control policies that are very lengthy on the hospital side, and when you break them down into the processes, they don't apply to the rural health clinic. So it's perfectly okay to go by our parent hospital policies, but again, we want our rural health clinic policies to be very concise, and we want them to be focused on the conditions of certification. So I think I've said most of these tips already. You guys know I'm really bad about getting ahead of myself. So we want to focus on being straightforward and clear in our policy development, in our language. We want broad language that establishes compliance without locking us into a rigid process or a procedure that might change frequently. We also want to organize our policies in a way that makes sense to us. How can they easily be retrieved? So we may want to organize our policies topically. You may want to organize them by the survey tags or by the accreditor standards. And we want to have a standard format for our policies. So often you'll see out on one of the forums, you know, can you share your policy about, I don't know, hand washing with me? And then when we go to review policies, we'll see where somebody just whited out that clinic's name and just put it in their binder. So we want to have a standard format. We want to know where to look for something and how it should be easily found. And this is really important, is that we don't want to use policies to manage people. We want policies to ensure compliance. So we don't want to be passive aggressive in our policies. We don't want to talk about where to park and where not to park. And we don't want to talk about petty things like, are your tennis shoes clean? Are your scrubs wrinkled? Those are things we can handle in employee handbooks, or we can handle in orientation. So let's keep our rural health clinic policies very straightforward and focused towards being compliant with 491. Here's an example of how a policy might look if we were trying to have a standard format and we were trying to organize them in a way that they can easily be retrieved. So these actually is a sample. This is a sample of policies that our company develops. I'm just showing them as an example. So we have them organized by the type of policy. Every policy is numbered, is sequentially numbered. And then we have a reference to both the survey J tags from the Appendix G and to the 491 itself. Now that's a lot of trouble to go to, but if a surveyor asks you, how can you demonstrate compliance with a certain survey tag, you'll be able to have that cross-referenced. We also want a very clear and clean format. Most of our surveyors come from a hospital background, so if we can make our policies, look clean and fresh, look organized, then that's going to help the surveyor find their way around our policies as well. So we're going to now shift gears a little bit, and we're going to talk about developing policies that are effective in maintaining compliance. So isn't that the reason that we have written policies and procedures in the first place, is to ensure compliance? And when we're talking about compliance with rural health clinics, if you're part of a bigger organization, your hospital compliance officer, your hospital quality person, they may not be familiar with 42 CFR 491. It's what we live by every day, so we may need to bring that regulatory framework into introduce that so that other people within our organization understand rural health clinic compliance. I wish we had the time to just stop everything and focus on developing the perfect strategic plan for compliance. But that's just not how we roll in healthcare. We're very reactive by nature in our industry. But our very first step in having effective policies and procedures is changing our mindset about compliance and trying to be where we're not so reactive. You can see this quote at the top of the slide. This is not new. So everything that we do, we either do it because we want to prevent pain or we want to give ourselves some kind of pleasure. So if we spend the time on our policies and procedures, we're going to be doing both. We're going to have that confidence that we're compliant, that we have what we need. We have a practical blueprint. We have a practical blueprint that we're going to do business by. And then we're going to be able to satisfy any requirement that a surveyor would have when they come into our clinic. So we need to try to be a little bit more proactive in the way that we approach policies. Again, just another example of how we can systematically organize our policies. Again, these are organized by a broad topic of what type of policy they are. They're all specifically numbered. But when we're talking about rural health clinic compliance, we have to go a step further than just the written policies and procedures, because we also have to maintain evidence documents. So there are certain things that the surveyor or the accreditor is going to look for to make sure we're in compliance with our policies, make sure we're in compliance with 491. And so you may want to organize your evidence documents where they correlate very nicely with your policies. And so we need to identify which documents are going to evidence compliance. So if our policy under organizational, remember we talked about organizational structure, we have to have a policy for organizational structure. What outside documents, what proof do we have to show that surveyor that we're in compliance? Do we have an ownership notice posted? Do our employees know who our compliance officer is? Do we have an org chart? Does everybody need to know who they go to, what the chain of command is? So we need to identify evidence documents, and then we need to organize them so that when the surveyor shows up, we're not running around looking for 20 different manila folders. We have that evidence organized in a way that it proves compliance with our policies. This is just an example of how you could do it. You could have the policy about a specific topic. This is a policy about a regulatory compliance in general. So we're going to have our Medicare enrollment documents. We're going to have our CLIA certificate. We're going to have a state or city or county business license if we need one. All those things demonstrate compliance. Examples of evidence documents you might look for are copies of licenses. That would be, in Oregon, you're not licensed as RHCs, but your professional licenses for your providers. Any kind of certifications or certificates, any kind of inspection reports, fire marshal inspection reports, building code inspection reports. We're going to want to keep up with correspondence from our Medicare contractor and our state agencies. And so these are just examples of some things that might be evidence documents. Because we have to prove we're in compliance. If we can't prove we're in compliance, then we really raise a lot of questions with the surveyor, and we scramble around and we show that we don't have that blueprint in place to do business by every day. And so we want to identify those survey documents, and we want to be able to retrieve those easily. And again, changing our mindset about compliance is the very first step. We're also going to want to implement a training and review program of our policies. And so this is something that surveyors are going to be looking for. So we've created this blueprint. We know how we're going to do business every day to stay in compliance with regulations. How are we going to let our employees know that? How are we going to do that? So the very first part of any kind of training is that we need to create engagement with the staff and get that buy-in from everybody. Sometimes I think that when we do initial orientation, it's kind of form over substance. Here, check this, sign that you read that, and we really don't focus on interactive training that really equips our staff. Your accreditors and your state surveyors, they're free to question your staff on policies and procedures. So we need to make sure that we train everybody on those. We want to train at hire and then periodically thereafter. And we want that training of that policy to tie to that employee's job description for their daily work task as much as we can, because we want to be able, again, to be living our compliance plan, living our policies. If our policies are up on a big binder on the shelf in the manager's office, and they're only taken down once a year or twice, once every 2 years to get a signature in front of the book, I know how you guys really roll with that, then we're not engaging the staff and we're not teaching our staff to live our compliance. And so training our staff is really important. We're talking about the certification standards right now, but we also need to train our staff on corporate compliance, how to identify fraud and abuse, non-discrimination, non-retaliation if they report an issue. Your accreditors are going to look for a standard of conduct where your employee, again, buys in, signs off on that training and on the content of that policy. And so we want a training program upon hire. We want it to, again, be periodic thereafter or whenever we have a significant change in our policies. So it does no good to put hundreds of hours into policy development if we don't push them out to our staff and we don't make sure that we're all creating a culture of compliance and that people know how to do their job within, again, our framework, our blueprint. So we really want an effective training program. And then the next thing that we want to do is build a fail-proof tickler system. One of our biggest problems is we put a lot of time and effort into getting certified, into developing our policies and procedures at the very beginning, and then we fail to maintain those. And so we need some kind of a fail-proof tickler system for policies and procedures. And there's a number of ways that you can do this, because if we have something that falls in the cracks or we miss a deadline, that could be a survey deficiency the next time that somebody walks through our door. Maybe your organization has a policy management system or a document management system. Some of those will have built-in tickler functions, which is perfect, but not all of them do. Or perhaps you have written policies and procedures that are not part of a management system. How are you going to keep up with things that need to be done? So we can use spreadsheets. We can use a desk calendar with notes to ourselves. We can use any kind of organization tool that's going to remind us that we have a deadline. So anytime in your policy where you have said that you're going to do something periodically, drug inventory is going to be monthly, policy review is going to be biennial, the medical director's review of charts is going to be so many per month. Anytime our written policy creates an interval for a task, or anytime that we have something that's an evidence document that's going to renew our CLIA certificate, our medical director's license, our nurse practitioner's ACLS certificate, anytime we have anything that's time sensitive, we need a way to remind ourselves of that. It's when we kind of put that book back up on the shelf and we don't think about it again that we create an issue with compliance. And so here are some of the things that might have deadlines or be time sensitive. Annual performance evaluations. When is our program evaluation due again? When is our emergency preparedness due? Is it going to be 2 years since our tabletop or 2 years since we did an active shooter drill? Is it time to retrain and come up with another testing and training event? Things with employee health. Is it time for our employees to have their TB skin test again? Again, anything that our policy specifically says requires review, we need some kind of a reminder system built in. This next slide is an example of the tickler system that we use. It doesn't have to be this fancy. These are color-coded as far as when the deadlines are coming up. And again, we're dealing with policies and evidence documents. So whatever you can do to keep yourself on track, we have found that if you organize these tasks, you can keep your policies and your evidence up to date by only managing 2 or 3 tasks a week, and that's excluding holidays and flu seasons. So we need to make this manageable, very manageable for you. And then the other thing that we need to do when we're talking about keeping our policies and procedures efficient, keeping them to be that blueprint that we need, is that we need to monitor regulatory changes. This can be really hard for a clinic administrator or a clinic manager because you're spending a lot of your time focusing on operating the clinic, ordering supplies, keeping your physicians and your nurse practitioners happy, building repairs. So you're doing everything as far as running the clinic day to day. It's very difficult to monitor regulatory changes. And so this is where belonging to organizations like the National Rural Health Association, the National Association of Rural Health Clinics, being signed up for listservs and forums, being signed up for things that the state office is pushing out to you, very important to help you monitor regulatory changes. So We don't need to wait for a survey deficiency. Again, we were at a clinic recently that did not know that the emergency drug kit guidelines had changed for rural health clinics. And so we were able to update them on that. But how are you going to stay up to date? The other thing is, if you're new in your position, you don't need to assume that what you've inherited is correct or complete. Sometimes even corporate level policies can fail to meet that 491 regulation. So again, you don't want to assume that what you've inherited is correct, or that what you put in place is never going to change. And so we need to make sure we can keep up with those regulatory changes. And I think you have great resources at your fingertips for that. And again, we don't want to wait for a survey deficiency to reveal that gap. And so when we're looking at other ways that we can keep up with monitoring changes, you can attend events like this. Oh my goodness, won't we all be glad when we can meet face to face again, and I can catch up and put names with faces, and you can see other organizations that you've networked with in the past. It's just going to be so good when all this is over and we can actually attend state and regional and national meetings again. But in the meantime, we can keep up through news feeds and forums and even social media pages to keep us up to date with what's going on with regulations. We can set up, but sometimes that can be overwhelming. So what I do is I'll set up email folders where everything that comes from NRHA goes to one folder. Everything that goes from a particular state office goes to one folder. And then you can allocate time once a week or once every other day to go in and review those folders and keep what you need. Because we all end up, I think I have 3,000 unread emails right now. So any way we can manage that mail is a great way to do that. Attend these kind of events, and then develop relationships with other stakeholders outside your organization. So your State Office of Rural Health is an amazing resource. They may be able to connect you with another hospital or clinic that's similar to yours, or that has overcome a challenge like yours. So we can't underestimate the significance of networking. This has kind of gone very quickly, guys, and I hope I haven't spoken too fast. We're going to review everything we've gone over so far, and I'm going to kind of hit the high points of everything. So our very first thing when we're approaching rural health clinics policies and procedures is that we want to create a paradigm shift. We want to change the way that we think about policies and procedures. We want to quit thinking about them being that big binder up on the manager's shelf, and we want to start thinking about them as a day-to-day blueprint on how we do business in our rural health clinic. And so we really want a mindset, a culture that creates buy-in from all of our employees. We want buy-in from our providers. We want to bring them into policy development. We need to make them aware of what the RHC regulations are. So we want to create that culture. We want people to be able to ask questions about our policies and procedures, and question and make suggestions on things that they think might be more efficient and effective in our clinic. And we want to use those federal regulations as our compliance blueprint. Remember, we talked about we don't build a house, you don't even build a barn or a storage building or anything without a plan. So why would we operate our rural health clinic and just start creating policies, pulling from here and pulling from there, if we don't have a compliance blueprint? So our regulatory guidance gives us that blueprint. You have a lot of resources available to you in interpreting those regulations and getting them put into practical policies and procedures. So we want to make sure we're going by that blueprint. A couple of days ago, I was at a clinic, and they had two big 6-inch binders of policies. There were policies on everything that you could think of, but do you know what was missing? What was missing were the policies that they needed out of 491. They didn't have any rural health clinic policies in any of those two binders. They just had a menagerie of policies that they had pulled from here and from there. So again, more is not more when we talk about developing policies and procedures. We want targeted policies and procedures that help us stay compliant with being a rural health clinic. And we want very straightforward, very easy to read and easy to follow policies and procedures. And then to go along with those policies and procedures, we want to identify any supporting evidence documents that a surveyor might want to look for. And again, we're going to want those supporting evidence documents to be organized and easy to retrieve. We don't want that surveyor to come through the front door and then we're scrambling because this piece of paper is over at the hospital and this piece of paper was in a folder, but is that in Susie's office? Is that in Bob's office? Where are we going to pull all that evidence together? So if we don't want copies of evidence, then we need everything cross-referenced to where we can find it. Again, we don't want to be scrambling. And then very important, we're going to be able to create that buy-in with our employees because we have implemented a training and review process of how we're going to do that. And so it does no good to have that binder on the shelf, to have those policies on the common drive of the network if our employees are not using those to do business every day, or if they have a question about a policy, or what do we do if this happens, they don't know where to find the answer. So we need to make the policies accessible to them. And then we want to make sure after we get all that in motion that nothing falls in between the cracks. So we want some kind of a tickler system to remind us it's time to do policy review. It's time to renew a medical license. It's time to redo emergency preparedness training. It's time to do a new emergency preparedness risk assessment. You know, next month we're going to need to reapply for our CLIA certificate. You know, at the end of the year, it's going to be time to do all the performance evaluations for our employees. How are we going to keep all that manageable? So we're going to have some kind of a reminder system, whether it's built in through our document management system, or if it's something that we've created through a spreadsheet or a calendar system. So we're going to want that built-in tickler system. And really important as we're trying to wrap some of this up is we need to make sure that we have a way to monitor regulatory changes and find out what's going on. What are surveyors looking for? Has there been a proposed or a final rule coming out that affects rural health clinics? Again, your go-to places to find out regulatory changes is going to be your state office. They're going to push those things out to you when they become aware of them. You've got a great staff in your state office. We enjoy working with them so much. So also being a part of the listservs and the forums from the National Association of Rural Health Clinics, from the National Rural Health Association, from your state Rural Health Association, is get those news feeds, get those updates. You can sign up for regular emails from your Medicare contractor that's going to let you know when there's a new MedLearn Matters on some topic, or when they've changed a process in the way that they process claims, or what are they seeing as the top deficiencies. So all of those ways are things to keep up with regulatory changes. And so figure out what works for you. Networking, attending these conferences, these virtual conferences. Next year, hopefully, we'll be in person again. That will be so great. And so those are the 7 steps. We need to make sure we have a culture of compliance. We know what federal regulations create our regulatory blueprint. When we develop policies and procedures, we need to make sure that that we're writing them in a way that's clear and concise and organizing them. Having those necessary evidence documents, training our staff, building in a system that keeps us compliant. We want to be in perpetual compliance. We don't want to get started as a rural health clinic, put that book on the shelf and forget about it until the surveyor walks in the door. And we want to keep current and relevant with everything that's going on in the RHC world. So those are our seven steps for creating a culture of compliance through our written policies and procedures. I know we're going to have time in the chat box to answer questions, so we invite you to do that. Also, if you would like to follow Inquisique Consulting on social media, we answer questions and push out information to you as often as we can. We won't harass you or solicit anything. We just want to kind of be another one of those information sources. And I think I'm finishing a little bit early, which is going to give us a lot of time for questions and answers. So let us know what you need follow-up on. On the last slide, I'm going to give you my email and my cell phone number. So we always answer follow-up questions from any conference to make sure that we've been clear and that you get the information that you need. So just feel free to send me an email if there's anything in this presentation that has been confusing, or if I didn't quite answer the concern that you had, or you think of one later on as we go through this. So thank you again for letting me participate in this year's conference. And hopefully next year we'll be back in beautiful Bend, and the fall leaves are much prettier there than they are here. So I really look forward to that. Thank you so much, and enjoy the rest of the conference. Thank you.
Thank you, Patty, for this wonderful presentation. We will now go to the question and answer session.
Hello, everyone, and welcome to the Q&A portion of this session. Please use the Q&A box to add your questions for the presenter. Okay, Patty, I'm going to start off with a couple of questions. Can we make our own schedule to review different parts of our manual throughout the year rather than waiting and doing it all at once? And that was from Deb Bartell.
Hey, Deb, that's a great question. And don't y'all like how my hair went from straight to curly in just a really quick minute there? So yes, you can have a systematic review of your policies throughout the year. You may want to take a certain section of those policies and review those. That's where you're going to find things that need to be updated. The two things we need to keep in mind is you're going to want to recap the review of those policies in your program evaluation. And you're going to want to make sure that your medical director and your providers attest that they have reviewed those policies at the required interval. But yes, we actually use a calendar to spread out reviewing policies and evidence documents throughout the year so that you make it manageable. And so you don't have it, if your fiscal year and the calendar year are the same, you're going to end up with all that jammed up right around Christmas, New Year's. So yes, you can certainly come up with your own schedule and review it. Just make sure you keep up with that review process and you recap that as part of your program evaluation.
Okay, great. Harriet Steinberg is asking, have you updated the policy for release of information in accordance with the new 21st Century Cures Act?
Okay, so that sounds like that might be a question directed to our specific policies and procedures, but I'm going to address that for everybody because that's really great. It's really a very hot topic right now. So we do have an interim final rule that's going to require our patients to be able to have open access to their records through the EHR, and that's going to I think going to be required in April of 2021. So a lot of this is going to deal with your EHR and making sure that your EHR remains certified by the ONC and that it has those features to it, but it also may require a change of your policy, either a health information technology policy that you have or a medical records release policy. This is something that's come up through COVID because we have found out that it hasn't been as easy for patients to get their records during the public health emergency, with facilities being closed and the need for telehealth and all of those things that have changed right before our eyes. So we will be looking at our particular policies to see if they need to be revised. So I would suggest that you do the same thing. Policies that may be affected are going to be release of information, open access for your patients to be able to retrieve records through your certified EHR product, and other internal processes that you have that relate to that. So yes, that's a great question. And we have not revised ours yet, but we will be looking at that to make sure that we have that in place by the deadline.
Okay, great. Deb Bartel is asking, if we have non-RHC policies that intermix RHC required policies, is it okay to house them together, or should we keep them together in the RHC manual?
Okay, that's another great question. And so how we typically recommend that, say we have our rural health clinic policy, but there are parts of our hospital policy that also may apply to the rural health clinic. Maybe it's something broad like HR or other employment policies or vacation, other things like that, that apply to everybody within our organization. What we will do is we will put the RHC policy first, and then I'm going to put I don't really want to call it an addendum, but I usually put a piece of paper and it says, this hospital policy may also apply to the rural health clinic, the sections of it that are pertinent. So the sections of the hospital policy, which also apply to the rural health clinic, may be followed in addition to the rural health clinic policy. So we don't necessarily want to include the whole hospital policy if, like I said before, there are sections of it that don't apply to how we do business in the rural health clinic. So I may reference a hospital policy. If I didn't want to have it in my big binder, then I could just say other sections of hospital policy 250 apply to the rural health clinic for HR management, employment, some other topic that broadly covers. But I don't want to just put the whole hospital policy in there without some kind of disclaimer that that whole policy may not apply to the clinic. I don't know if that answered the question or not. Did that answer it, Deb? So it's your choice. Okay, good. She said yes. Okay, great.
Okay, yeah, good.
Yeah, what we don't want is a whole hospital policy that has something in it like, report this to the charge nurse and put your bloody scrubs in the closet on the 3rd floor when we don't have a 3rd floor in our rural health clinic. So we just want to make sure we don't have a policy in there that doesn't apply to us at all.
Okay, that makes sense.
Okay.
Let's see. Next question. What if I want, let's see, that's kind of the same question. Okay, I'm going to read this and tell me if you think this is pretty much the same question. What if I want more policies than are required in the 42 CFR 491 conditions for certification?
Well, so your policies, they're your playbook. They're how you're doing business every day. So if you feel like you need more written policies to give guidance, have as many as you think you need to efficiently manage your clinic. But what we don't want is we don't want to manage by policies. So we don't want to create a policy every time we have a people issue, because that's not the purpose of our policies. Our policies are to mandate compliance, those broad mandates of compliance. So we don't want to, sometimes you'll say, oh, well, we had this issue with that nurse, and so I'm going to write a whole new policy about it. So we don't want to manage by policies. We want policies to be our compliance framework. That's what we were talking about in the presentation. So you can have as many as you need, or if you need sub-policies, or you need addendums to policies, or you need to include other internal documents in your evidence binder that give guidance on how particular things are done. So you certainly are not limited to those, but what we find is people have a lot of policies and they leave out the ones they really need. So make sure you have the ones that meet the conditions of certification, and you certainly can add to them however you want to. Just make sure you don't make them so clunky that they're difficult to follow and overwhelming for your staff.
Okay, on to the next question. Great. Let's see. Do the RHC policies need to be approved through the parent hospital's committee structure?
Oh, okay. So that's another good question. So nothing in CFR 491 says that your policies need to be approved by your parent organization if you're provider-based. 491 says your policies need to be developed and reviewed by your medical director and your providers and your key clinic staff. However, I know that it's very common for hospitals and other parent entities to want everything to go up through the committee process, everything up through the approval process. So there's nothing wrong with them doing that, but when you get to that policy attestation that's required in 491, you want that to be the people that are required by 491 to attest to those policies. So I don't want my CEO of the hospital and my board chairman to have signed off on them and not have my medical director or my provider sign off on them. So you can have extra attestations, you can have minutes which show that the policies went through an approval process. That again, that's fine, but it's not required in 491 if I was just looking at 491 alone.
Thank you. What approvals are necessary for RHC compliance?
Okay, so I may have jumped ahead and answered that as part of the last question. So if we go to 491, it's going to say in our program evaluation that our policies have to be reviewed, by those designated RHC people and an outside reviewer. So that can be your RHC consultant, that can be somebody else in your community that's a healthcare professional. Some states have a lot of extra people that are required. I don't think that you guys do. So again, you can have more than are required, but just make sure you have the ones that are actually required as part of the program evaluation.
My medical director is contracted and does not understand that is a requirement for her to review the RHC policies. What should I do? Okay, so we get this a lot because we often have trouble finding a medical director, or maybe we think that that medical director for the RHC has the same responsibilities as another medical director within our organization. So I like to see that requirement of policy development and review actually in the job description for the medical director, or I like to see it in the agreement with the medical director so that it's clear. But if we don't have that, if we've got a medical director and they don't understand that, then, without hitting them over the head with your big 6-inch binder, I would just say, hey, let me just show you. Rural health clinics are different. And this is what's different about them. And to keep our regulation, to keep our certification, we have to have you involved in this. What can I do to help you with that? What can I help to, make that available? Okay, perfect. Can my policies be only available electronically? Do I need a printed copy of policies?
Okay. That's another good question. And I see that Deb has another question in the Q&A box.
Okay.
Let me talk about that for a minute, and then I'll move on to the next question. Okay. So I don't know. We are required to have a medical director. So the reg doesn't talk about if we have co-medical directors. But if we have co-medical directors, more than one physician in charge of the medical management, then I would think everything applies to both of those people that share that responsibility. because, you know, we're going to have to demonstrate that they both participated in policy development and review and in the medical management guidelines that are established for the clinic. So, so I think we would just have to make it all apply to both of them. So then the other question that we had, remind me.
Okay, it says, can my policies be only available electronically? Do I need a printed copy of the policies?
Okay, so I will just be honest with you, there are different opinions about this. So I would say if your policies are on a common drive on your hospital's system, and there's a possibility that that whole system could go down, you probably do want a backup printed copy if they're part of your hospital's intranet. If your policies are cloud-based and you can get to them in other ways other than through your hospital intranet, then I wouldn't feel as strongly about those being printed out. So the problem that we have with printed out policies is, what if something gets changed on the electronic copy and it doesn't get updated on the printed out copy? Which one am I going to go by? So if you do print out a copy of your policies and procedures to have as a backup or to have for surveyor review, have a way of knowing that those are match up and are in sync with the ones that are electronic. We have actually had a clinic with electronic policies print out a paper binder, a policy be revised that didn't meet 491, and they got dinged on something that was in their paper binder, although their electronic copy was up to date. The only other thing I would say is that for your emergency preparedness plan, if it's part of your written policies and procedures, I would also have a copy of that printed out. So we aren't seeing the surveyors require a printed out copy as far as the compliance team, but I can't speak to your state surveyors and what their expectation is. So I don't know, Rhonda, and you may know what the state surveyors are expecting.
Yes, it's okay if they're electronic.
Yeah.
Janet has told us that it's fine as long as they can retrieve a policy that she's looking for.
Okay. And the same thing I would say, as long as you can get to it when you need it, it's fine. But, you know, I know older school surveyors may have a different opinion about that. There's nothing in the regulation that says where that has to be located. Okay,
so we are hitting our time. I have one last question. So can you explain to everyone the difference between 42 CFR 491 and Appendix G State Operation Manual? I think sometimes there's some confusion there, just so they understand the difference.
Oh, yeah. So that's really good. So the CFR stands for Code of Federal Regulation. So that's actually the federal law that establishes the conditions of certification for RHC. So it's the law. The Appendix G is another CMS document that is an interpretive guide to the CFR. So the Appendix G is kind of like a field manual for state surveyors to say it breaks the state reg down into the survey tags. And then under each survey tag, it's telling the surveyor what they need to look for that the clinic would have that would demonstrate compliance. The Appendix G is sub-regulatory, meaning the Appendix G is not law. The 491 is law. So, so the Appendix G can be challenged. You still may get a citation for it, but it can be challenged. So Appendix G is the surveyor's field guide for what they're looking for. CFR is the actual federal code.
Thank you. That's perfect. Well, this pretty much wraps up the session. I think we've answered all the questions. So we are going to take a short break and return at 12:30 to listen to Katie Jo Rabel from Whipley share key strategies for growing your RHC. Thank you, Patty. You have been wonderful and full of information as always. And thank you everyone for attending this session.
Thank you very much. Bye now.